Getting the PowerPoint to connect, I'm having a little trouble. 50 questions, there'll be 5 math. Please make sure you have a whiteboard ready to go. 2 devices for your test as well. Any questions on that you have before I start? No, I'm sorry, I'm just trying to pull it up. The computer's being very slow for some reason. Just give me 1 second. I'm gonna log on from another computer and hopefully that will help. Just give me. All right, I'm going to start sharing my PowerPoint for you guys, and you will see I always do a PowerPoint for the reviews. I find that that's helpful. I don't share them, but I do have this recording and we'll share it with all your teachers. So again, 50 questions, 5 math, and let's look at our slideshow right now. Okay, first thing we're going to look at is we're going to look at consequences of poverty in rural areas. We do know that groups at highest risk are kids, minority, racial and ethnic groups, and single parent families, of course, those headed by a woman. Among racial minority groups, Hispanic rate has increased the most. Number of college degrees remains far lower than for our urban residents, and this gap continues to increase over time. So think about what that does to employment over time. All right, when we're looking at the physical impacts of harvesting crops, 12 to 14 hours a day, I want you to look at the pictures and think about these people are bent over 12 to 14 hours a day on their musculoskeletal system. Back and neck pain are our most common types of chronic pain. Low back pain that radiates into one leg, we know is sciatica, which is consistent with our herniated lumbar disc. Nurse assesses client to see whether the pain is aggravated by events that increase pressure such as bending, lifting, sneezing, coughing, or lifting the leg straight up. So some things to think about with our rural clients. We know our rural clients are less likely to participate in activities during leisure time. They have decreased compliance with safety precautions, such as wearing a seatbelt. They don't engage in preventative health screenings. We know chronic disease is more prevalent among our rural. Lack of anonymity among rural communities, which makes reporting health issues a challenge. So you're going to see far less reporting on sexual abuse, drug use, or depression, okay? Based on the concern that others will figure it out. Primary, secondary, and tertiary preventions on our exposure to pesticides. Primary intervention strategy would be to provide education. It's always going to be primary education and teach workers how to reduce their exposure before they are exposed. Hand washing stations and conducting screenings such as urine testing is going to be our secondary, and initiating treatment for symptoms will be our tertiary. So we know they have an overall decrease in health status when compared to urban clients. I'm repeating myself here. No chronic disease is much more prevalent in our rural clients. Cultural considerations we should think about with our Mexican culture. This is a culture that you guys had some reading about. Nurse should be considered an authority figure who should respect the individual, be able to relate to the individual, and maintain the individual's dignity. Mexican culture expects to establish some rapport through chit chat for first few minutes before addressing any problems. Touching is seen as a caring gesture. Okay, so make sure that you're familiar with all of those when we're interacting with our Mexican population. Families with children are our fastest growing segment of the homeless population. Single motherhood is increasing. We see a direct correlation between lack of education and poverty, and a direct correlation between poverty and poor health outcomes. Poor teens are nearly 3 times more likely to drop out of school as their non-poor counterparts. When programs that assist the mother to complete her education are instituted, chances are for a better future. Important to have pregnant adolescents in school during the pregnancy and have her return to school as soon as possible for that benefit. We know our homeless population has the same problem accessing care as those do in poverty. Usually it's crisis oriented. We see them in the ERs where the cost of service is high, but it is not refused as is office and clinics. Homeless adolescents living on the streets exhibit the greatest high risk behaviors, including high risk for contracting HIV, hepatitis, and more likely to use alcohol and drug substances. Our vulnerable populations in HIV, just please remember HIV is transmitted by sexual contact and the exchange of bodily fluids, exposure, and passage from an infected woman to her fetus. Clients who fall into a high-risk category are going to be those who use IV drug use, experience personal and recurrent sexual transmitted diseases, and those who have multiple sex partners. Community health providers, we help with our culture of youth by creating coalitions and partnerships and providing activities to increase social skills. We see an increase in social skills, we'll see a decrease in violence among our teen population. We know the dangers of mixing drugs and alcohol, risks, factors. We see a codependence with violence, trauma, genetics. Know the dangers and how a community nurse would provide teaching on vaping and exposure. What are some primary and tertiary points? Remember, vaping oils are poisonous to children. That's something we would definitely teach about. We have parish nursing. We had 2 different types. We had congregational, where you focus on a specific congregation, take care of one large group all on your own. So you're going to have a lot more autonomy there. Institutional, you're going to have a liaison between the church and outside entities, have help in caring for communities with outside sources. Parish nurse and primary activities are going to do whole classes with youth and parents on healthy eating, encourage a variety of activities, encourage healthy snacks. Secondary prevention, we'll see some screenings, and tertiary weight reduction. We know when we're creating our care plans, we're looking at ADPI, right? And so when steering the conversation towards goals, the nurse is now able to work with the client to mutually identify outcomes. So when we're discussing health problems and limitations, the nurse is gathering history as part of the assessment. It allows for a nursing diagnosis. And when planning, we're hoping that the outcomes have been identified so a plan can be established. We talked about Medicare and Medicaid in the classroom. Medicare coverage, make sure you know that they must demonstrate the need for skilled nursing care, like caring for a new wound, teaching family members how to provide skilled services. Anything like custodial are not going to be reimbursed for Medicare. We know Medicaid is then based on lack of financial resources. Federal and state program administered by the state. In my class, I talk about the different names for Medicaid based on your home state. Medicare is going to be 65 and older, and those that are disabled. They'll only pay for home health services by skilled professionals while the client is homebound, while Medicaid does not necessarily require homebound status for home health aides. What's our primary goal of hospice care? We know quality care, comfort, and dignity. Federal agencies I want you guys to be familiar with, World Health Organization, OSHA, remember Occupational Safety and Health, and Agency for Research and Quality. All right, sorry about that. And we're gonna go back to those agencies, Agency for Research Equality. We know it's not federally funded, it's a state by state for nursing research and education. Epidemiology, we did this week. Epidemiology is going to be the study and distribution of factors that determine health-related states or events in a population. Analytic is going to look at the causes of the disease and deal with determinants of health and disease. Like, why does something happen? Why are some people more affected? You guys have some work on the epidemiological triangle this week, our host, environment, and agent. Remember, a host is who's getting whatever exposure to that agent. Could be biological, chemical, physical, nutrition. Disease is produced by exposure of a susceptible host to an agent in the presence of certain environmental factors. Like class, we talked a bunch about COVID and who got what and why they got it. Think about that with your epidemiological triangle. Case fatality rate, we talked about this as well. It's a proportion of people diagnosed with a particular disease who die within a certain area. As period. So if someone is asking, am I going to die from this? That's our case fatality rate. We know with contaminated foods or water, we're going to have a higher risk for illness with those who are immunocompromised. Okay. Environmental health, we talked about the needs and to what kind of things we look at. With our kids, we're going to worry about lead. So make sure house is 1978 and before, being careful about those kind of things, contaminated foods. We have air pollution, inadequate water, chemicals, radiation, occupational risks, agriculture, environments, and climate change. All of this is going to be how our environment impacts us. And what can we do as nurses to help minimize the impact of poor environments? And one more, just give me one brief second and I will continue with it. Sorry about that pause, guys. Okay. We're back to looking at different types of case studies. We have ecological, which is quick and easy, may prompt further investigation or suggest other or new hypotheses. So we have that one. And then we're going to take a look at our next type of study, which is going to be cross-sectional, where we have different things that are exposed and not exposed. And it's going to give a general description of the scope of the problem, provides prevalence and estimates. So it provides a snapshot or cross-section of a population or a group and current health based on current health status. We have retrospective, which is retro, think go backwards. So it's going to be based on existing records such as employment, insurance, or hospital records. Okay. Role of an occupational nurse, we know it's special practice that focuses on the preventative healthcare, health promotion, and health restoration within the context of a safe and healthy environment. Okay. Work in traditional manufacturing, industry, service, healthcare, construction sites, and government. That is my references. I'm gonna stop sharing and hopefully I recorded this. Yes, okay. Any questions before we end the review? I will post this for my students and I'll send it to your teachers as well. No? Alrighty, take it easy.
Thank you. Have a good night.
You too, bye-bye.